going to check my orders. I'm going to be gathering my equipment. I'm going to be providing privacy. And I'm going to be performing hand hygiene. Hello, my name is Samantha, and I'm going to be your student nurse today. May you please check your ID band to confirm your name and your date of birth?
Yeah, it's Isabella Moore, 92904.
All right, perfect. That checks out. And do you have any allergies specifically to tape or adhesives?
No.
No? Okay, perfect. So today we're going to be performing a dry dressing change. Are you familiar with that procedure?
Yep.
Okay, perfect. All right. So I am going to, you are in a comfortable position and there is no pain, right?
Yes.
Perfect. You are at working height. I'm going to lower the bed. Okay. And I am going to be applying, first I'm going to put my biohazard bag with agent policy. I'm going to be applying my clean gloves. So what we're going to be doing is I'm just going to be changing it, make sure that the wound is healing all right, and then we're going to put a new dressing on it. It's as easy as that. So putting these clean gloves on. Okay, I'm going to, my patient is in a comfortable position. I did not medicate. I'm going to only expose the wound. Okay, only the wound is exposed. And now I'm going to layer by layer take off the dressing and assess. So the first layer, AOC. Amount, there's no amount on this. There's no odor, and I'm not noting any color. Okay, now I'm going to discard per the agent policy. Now the second. Okay, I am noting the amount, there's 5% serous drainage, so that is the amount in the color, and I am noting no odor. And then on this one, it's about 10%, which is the amount, serous drainage, which is the color, and I'm not noting any odor. Again, discarding based on the agency policy. And now I'm going to be assessing the wound, the skin integrity, and the incision line. So first I am noting that the wound, okay, so we got exudate, which I noted that there was the 5 to 10% of the pad, the drainage, so that's the exudate. I'm noting no erythema and no edema. I am noting that the skin integrity is adequate and intact, and I am noting that there is no odor. Okay, cool on that. And now I am noting, so I don't see a drain. Okay, has your pain increased at all?
No, it has not.
Okay, pain has not increased. There is no odor. And now I'm going to be, okay, there's no drain. Now I'm going to be looking at the wound. Okay, so we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 staples. And they got the 3 E's. So approximation, so the wound is healing well. I noted the approximation. And again, no erythema, no edema. And I am also noting that there was a little bit of exudate, but not too much. Again, only the wound is exposed. And I am going to now dispose of my gloves. This would be up to for patient safety, but just for the demonstration, I'm just going to leave it down. I'm going to be discarding, and I'm going to be performing hand hygiene. And now we're going to be changing that wound. So this is dry, this is clean, aseptic technique. All right, so I'm just going to be, got this. I'm just going to be opening it all. It's not going to touch. Oh, this is not going to touch. This is not going to touch. All right, so this is open, hasn't touched. This is open, has not touched. And then I'm going to be getting my tape ready. So I'm going to be doing like the window technique when I do this. So I'm going to be getting those 4 pieces of tape. Again, my hands are clean. This is dry. Got these 4 pieces of tape. And then I'm going to get this little piece of tape. I'm going to be putting the name, the date, and the initials on this baby piece of tape right here. I'm just going to redo this because it discarded that. Okay, cool. Now I'm going to be applying clean gloves. Again, patient safety, but just for the demonstration, I'm right here discarding everything per the agency policy. And now that I'm ready to do the dry dressing change, I'm going to use aseptic technique and There's my equipment. And I'm gonna get these swabs, right? So from the least to the most affected, we're gonna clean that wound, right? Nope. Discard. Nope. Discard. Then least to most. Nope. Discard. Okay. Now we got our 2 clean pads laid down there. Got this. Laid down here. All of this I will be discarding per Asian policy. And now I am going to be aseptically placing that tape. Got no allergies to the adhesive here. Okay, there's some drain. Doing pretty good. Are you comfortable? You're experiencing no pain? Pain has not increased still?
No pain, I'm comfortable.
All right. Patient's in a comfortable position. That window box method. Cool beans. All right, now we gotta get that date, initial, and time. Place it right in the top. All right, are you comfortable? Is there anything else I can do for you?
No, I'm good, thank you.
All right, got that clean dressing. You did a great job. We're gonna put this down, lower this down. All right, your call bell is within reach. Your personal belongings are within reach. My patient is comfortable. My patient is in no pain. This is as low as the bed will go. I'm gonna be getting my tapes. And I'm gonna be discarding. Got all of my equipment, so I'm gonna be washing my hands, performing hand hygiene, dispose of my equipment, and document my findings.